Hello, this is now week 7. I was going to try and do weekly updates, but life got in the way last week. So week 7 of updates on my surgery and the ongoing recovery. Been a rough couple of weeks really. Last week I'd pretty much been out of the sling ever since I last did this video. Only going in and out the sling really when I've been on public transport, more to let people realise there's a problem with my arm, more than anything else. There's been a lot of pain, certainly aching, real sort of just a lot of pain in my shoulder, especially doing physio exercises. I had an appointment with the physio yesterday and they've started recommending more active and active assist exercises to start getting the range of motion back. There was a bit where he said, "Oh, just show me your current range of motion," and lifted his arm above his head like this, and I was like, "Oh, okay." And it was poor. This arm barely, it wouldn't have got in shot. So yeah, that's not great at all. So I've got a whole list of exercises to do. There's a couple where I physically can't do them, so next time I see him, which is in a couple of weeks, I'll just have to explain though my arm just physically won't move in that direction. I'm guessing that's not a good thing. I'll just have to see what he says. Appointment with the consultant is in a couple of weeks. As I say, I'll mention to him about the pain getting worse. I'm hoping it's nothing to do with the surgical repair and it's just the muscles starting to get used again. I'm feeling that bit of pain from that. What else is there to tell you? Sleeping has been hit and miss. Certainly sleeping upright in this sort of position, it was never great in the first place. It's not been a lot of fun. I can now lay on this side and sort of prop my other arm up, which has been quite nice. But again, I tend to wake up in the night in some degree of pain. I just can't see that going away anytime soon. So that's about it really. I'd say a lot of pain, not a huge amount of improvement in terms of the range of motion. I've got some pretty gnarly scarring. You can see that's the main scar from where they did the humerus operation, and then there's another one across the back where they did the scapula. Fortunately, those seem to be healing, cross fingers, with no signs of infection, and that's been the main positive. Is hopefully that side of things is good. It's one of those things where you probably shouldn't read up about issues and potential issues, but my humerus was broken into 4 pieces, and there is a risk that the 4th piece, which is at the top here, may develop osteonecrosis, which means that if it doesn't, because it was cut off from the blood supply, if it's not repaired sufficiently in time, the bone will just die, which will then involve bone grafts and more surgeries to try and correct that issue. I mean, fingers crossed it doesn't come to that, but there's no way of knowing until a bit further down the line. They'll say it's either healing or it's not healing. It's a bit hard not to be paranoid about that at the moment. Yeah, so that's it really. I can't really demonstrate to you vast levels of improvement because there really haven't been any. I have been able to use my left hand a bit more, sort of stuff where you'd use 2 hands but you don't need the hand to be active. I mean, just holding while I'm chopping vegetables and things like that when I'm doing the cooking, it's good enough for that. It can, when it's in sort of a 90-degree angle, I can just about lift light things with it, but virtually it's a good job I'm right-handed because I've been using my right hand for everything. Right, so that's my 7-week update. Again, it'll probably be another 2 weeks, so probably be at the 9-week mark. My sick note runs out at the end of 8 weeks, so I'll be going to the doctors to see whether they feel I'm ready to go back to work. But I mean, I haven't driven yet since, and I don't feel up to to starting work again, but I guess we'll see what they say. And that's it. Again, any questions, just put something in the comments if you've got anything to ask. I'm not a medical professional, but can probably answer to the best of my ability. And yeah, that's it. Take care, everyone.